Hi, I'm Jeff Steinle. I'm a corporate and securities lawyer at Fredrikson and Byron in Minneapolis. I serve as outside general counsel for healthcare and medical device companies, as well as companies in the broader life sciences area. On a day-to-day basis, I work on mergers and acquisitions, investment transactions, joint ventures, and various commercial transactions. I also co-chair a life sciences group along with Ryan Johnson.
Thanks, Jeff. I'm Ryan Johnson, a corporate healthcare attorney at Fredrikson and Byron. I represent healthcare investors, technology companies, including digital health companies, providers, and innovators who are using technology and innovative business models to improve quality and reduce the cost of healthcare. Like Jeff, I serve as outside general counsel for many of my clients, representing them in acquisitions, financings, joint ventures, and other corporate transactions. I also advise clients on healthcare regulatory matters, including privacy and security, reimbursement, fraud and abuse, and various legal and regulatory issues arising from new and emerging technologies like artificial intelligence and new business models like digital therapeutics and direct-to-consumer health and wellness apps. Today, Jeff and I will be discussing value-based care in a post-COVID world.
It's probably no surprise that the COVID-19 pandemic was both a massive shock to the macroeconomy as well as to the deal-making environment in healthcare. And now it's easy to forget with the frothy and very active deal environment that we have now, just how much fear there was in early 2020 as the pandemic was first making its taking hold around the world. It impacted the ability to raise money, impacted the ability to complete M&A transactions. Now that environment has completely flipped. First is the capital impacts that we've had. So number one, there continues to be and has been a lot of private money on the sidelines. Secondly, we've had a lot of government support, kind of across the board through a variety of programs, but also programs that have really helped bolster healthcare during this environment. Then finally, of course, it's a very low interest rate environment. The other impact we see in healthcare is really an impact on focus. We open up our newspapers every day and see healthcare in the news, whether it's our skilled nurses or healthcare technology, the impact of COVID across our system. So it's really front and center for a lot of people and a lot of investors as they think about what they're going to invest in. COVID's also demonstrated a lack of resiliency in our healthcare system. An easy example is the lack of personal protective equipment early in the pandemic and some continued supply chain issues. So as a result of that, for people who are looking to do good with their invested dollars, healthcare investing is a great place to try to improve the overall system.
So we're seeing a number of trends relating to value-based care, including investments in telehealth, remote patient monitoring, behavioral health technologies, various diagnostic and tracking solutions, consumer-driven healthcare companies, and digital health solutions increasingly focused on the social determinants of health. Now, many of these trends are continuations of past trends, but in my opinion, the COVID-19 pandemic really accelerated and strengthened many of these trends. Before COVID, there had been a huge push to transition away from the fee-for-service model, which rewards utilization, to a more of a value-based care model. Now, CMS has been pushing providers to transition to value-based care for some time, and recently indicated that from CMS's perspective, virtual care and telehealth should really improve the total cost of care and really advance value-based care arrangements. Now, early on in the COVID-19 crisis, policymakers and payers acted fairly quickly to waive or suspend various legal, regulatory, and contractual barriers to providing telehealth during the public health emergency, including various burdensome reimbursement requirements, licensure requirements, et cetera. And these changes caused really an explosion in the number of telemedicine visits and use of other digital health and wellness solutions as providers, patients, and payers embraced virtual visits and other digital health solutions as a cost-effective way of providing healthcare during the pandemic. Now, I really think this helped advance provider and payer, and policymaker understanding of how telehealth and digital health tools can help improve care and reduce costs. which are, of course, key components to value-based care arrangements. Now, the pandemic also highlighted some of the health disparities and equity issues in our health system, including the significant impact of social determinants of health, which resulted, I believe, in even greater focus on addressing these issues. Now, part of the solution to these problems will definitely involve the use of various health solutions.
Ryan and I come at digital health from two different perspectives or two different angles, and we end up meeting at the middle of digital health. I work with a lot of medical technology and device clients that are increasingly using their devices to move into healthcare delivery, and they're doing it on a digital basis. Ryan will speak to this a little bit, but he comes at it more from the provider side. From the device side of the world, what I'm seeing is a lot of connected devices. So this is using digital platforms to connect devices to care providers. I'm seeing more sophisticated software and algorithms that are using devices for broader indications. We're also seeing how connected devices are integrated with care platforms so they can better address comorbidities.
Yeah, so digital health platforms are critically important components of value-based care arrangements for providers. What providers and patients need is access to high quality, meaningful data they can use to make better informed decisions and better manage the patient's health and wellness. And they need the ability to share this information with others. Now, from a provider's perspective, digital health tools need to support and really inform physician or clinician decision-making. Providers are looking for the right digital health solutions, which really have to be convenient and easy for clinicians, including physicians and other practitioners, to use. For example, there's a lot of opportunity to add functionality and tools to, each EHRs. So EHRs can include information, for example, that identifies social determinants of health risk factors for a particular patient or for a patient population, thereby allowing clinicians to address those disparities and creating a plan of care better suited for those patients. Now, this is important because some studies indicate that non-clinical factors like social determinants of health can influence up to 80% of a person's overall health. So lots of providers, including those who are involved in value-based care arrangements, are really looking for digital health tools to address some of these non-clinical factors. Providers also want digital health solutions that their patients will actually use, right? And patient and consumer engagement is critically important for many value-based care arrangements. So tools that can help patients with chronic diseases like diabetes, hypertension, or sleep issues. To the extent these tools can help patients better manage their care, that will result in better health outcomes and lower costs. One example for providers and patients is the fragmented nature of our health system. Patients often have multiple health issues at the same time. They see multiple providers or use multiple technologies to treat their various health conditions. But what patients really need, is a multidisciplinary integrated care model, which is delivered conveniently through virtual or other digital platforms. This technology-enabled approach will empower patients and providers by providing them with a more complete picture, really, and better ability to manage their health and their wellness. So that's kind of a long-winded way of saying that technology, particularly digital health solutions, really need to be at the center of value-based care arrangements. Meaningful, high-quality data and the ability of providers and patients to access, use, and share that data through the right digital health platform or solution will be a key part of the success of value-based care arrangements.
If there's a thread that continues through this very, very busy deal environment, it's that relationships are still critically important. There's good news and bad news of now doing this within, what can be a Zoom or a virtual environment. On the one hand, it's easier to kind of make quick video connections with people. On the other hand, I think it's harder to, maintain those relationships and do some of those social things that also help you, gain trust with someone and kind of develop a shared set of values as you move forward in doing a transaction. People are also moving around, so we think it's very important to maintain those connections and make introductions. Here at Fredrikson, we try to be a people and a place hub. We've got space, so we've got clients that are increasingly entirely virtual. They're taking the best talent from the various coasts or from here in Minneapolis, putting them together, but letting people live where they live. So we can provide a place and a connection hub, for those companies. And then the other thing that we really try to do is make connections across the ecosystem. That's both within our teams for, the various legal needs that our clients have, but it's also making connections across investment bankers and VCs, accountants, and just other like-minded individuals who are trying to address the problem in the system.
I agree with Jeff. Not much more to add. Developing and maintaining relationships is very important to our success as a law firm and our ability to help our clients succeed. So to wrap, on behalf of Jeff and me and Fredrikson and Byron, I want to thank MedCity for the opportunity to talk today about value-based care and for organizing another great digital health conference. Thanks so much.